What causes upper airway resistance syndrome? Have you ever wondered why some people struggle to breathe easily while they sleep, even when their airway does not completely collapse? This condition is known as upper airway resistance syndrome. Let's break down what causes this condition and how it connects to sleep apnea. Upper airway resistance syndrome occurs when the upper airway narrows during sleep. Unlike obstructive sleep apnea, where the airway fully collapses, this syndrome involves a partial obstruction. This narrowing restricts airflow, making it harder to breathe. As a result, the muscles responsible for breathing have to work much harder to get enough air into the lungs. This increased effort leads to frequent awakenings throughout the night, disrupting sleep quality. People with upper airway resistance syndrome often experience fatigue and daytime sleepiness as a result. Now, what causes this narrowing? Anatomical factors play a significant role. The upper airway, especially the pharynx, is a flexible tube made of muscles and soft tissues. Certain structural features can reduce the space in the airway. For instance, individuals with smaller jaws may have less room in their nasal passages and behind the base of the tongue. Other anatomical issues can include a deviated nasal septum, enlarged tonsils, or a narrow, hard palate. These conditions can decrease the airway size, making it more difficult for air to flow freely during sleep. Neuromuscular factors are also important. In upper airway resistance syndrome, the nerves in the palate remain as functional and responsive. This means that when the airway starts to narrow, the body can detect this early on. It activates muscles, such as the genioglossus, which helps keep the airway open. This response is why upper airway resistance syndrome involves increased resistance without complete obstruction. Interestingly, the nerve impairment seen in obstructive sleep apnea is not present in upper airway resistance syndrome. The exact reasons for this difference are still being studied. However, chronic irritation from issues like gastroesophageal reflux or repetitive snoring may contribute to nerve problems in obstructive sleep apnea. In upper airway resistance syndrome, the combination of anatomical narrowing and preserved nerve function leads to repeated microarousals during sleep. This results in fragmented sleep without the full apneas or hypopneas characteristic of obstructive sleep apnea. Understanding these causes is essential for effective diagnosis and treatment. Solutions may involve addressing nasal obstructions, improving airway anatomy, or using positive airway pressure devices. These approaches can help reduce resistance and improve overall sleep quality.